there is nothing in the Constitution which allows the federal government to provide this type of medical service to the people of the country. It's just not there.
There are some problems, okay, with so-called federalizing medical care, you know, and as it is here in the United States, a lot of us practitioners, we have difficulties treating a lot of patients simply because we can't use a lot of the medications that are out there, and we can't use them because they're out of formulary or they may be too expensive, out of the reach of the general population. You know, in this Obamacare, I'm just afraid that we're going to have one huge governmental HMO dictating what we can and what we cannot do.
I'm meeting so many women who are in my circumstances who are, you know, losing their homes, you know, having to live from couch to couch because they didn't have health insurance, they didn't have care, and they just had to pawn everything they had until they were poor enough to qualify for help from, you know, Red Cross or Cancer Society or some other government program for poverty-stricken people. Why do we have to wait for people to be poverty-stricken before we will help?
One of the objections that I have with regard to Obamacare is that the citizens are required to join, whether they want to or not. And that's what I'm opposed to, because that has to do with my freedoms and my liberties to make choices for myself.
What is freedom but the right to make our own individual choices? When the government regulates medical care, it is limiting the choices that we have.
The money has to come from somewhere, so that's another thing that, you know, I'm worried about, not knowing that we have such a fiscal deficit, okay, and there's a lot of questions.
The 75% wastage of money in all government programs. We are bankrupting ourselves. This country is bankrupting itself, and I don't believe that financially we're ever going to come out of it.